Good morning, everyone, and a very warm welcome to all the members of Indian Association of Medical Microbiology. I am Dr. Sangamitra Datta, working in the Institute of Clinical Microbiology and Immunology as a senior consultant at Sir Gangaram Hospital. And I am your host today for this podcast for our upcoming event, Microcon 2025. This conference is the 48th Annual Congress of Medical Microbiology, which will be organized by Sir Gangaram Hospital in association with Maulana Azad Medical College, New Delhi. The venue will be Hotel Ashok, which is situated in the Diplomatic Enclave at Chanakyapuri in New Delhi, and it will be held from the 29th of October 2025 till 2nd of November 2025. On the 29th of October, we'll be having pre-conference workshops at different venues, followed by the pre-conference CME on the 30th of October and the conference till 2nd of November 2025. It's an honor to have with me today Dr. Chand Wattal, who's the chairperson of the Institute of Clinical Microbiology and Immunology at Sir Gangaram Hospital. And he's also the organizing chairperson of the upcoming event, Microcon 2025. Dr. Chand Wattal has more than 40 years of rich experience in the field of clinical microbiology and has organized many workshops, CMEs, and conferences at state level. So let's hear some salient points regarding this conference from the organizing chairperson himself. Welcome, sir, and good morning. Sir, to begin with, what's the advantage of holding this annual congress in Delhi?
Good morning, Dr. Datta. Thanks for doing this informational podcast for our future delegates. Very shortly, we'll be having the Congress over here. The reason for getting this Congress to Delhi has been that, number one, it's quite some time that we had done last Congress of IMM, which was in year 2013. And in fact, the society usually prefers to take our Congress to smaller towns so that there is the kind of initiation of our younger and energetic colleagues to hold congresses in those areas. But then we do visit and ask for the venues in the metros like Bangalore or Mumbai, New Delhi, even Calcutta. And the advantage of bigger towns and metros is to gather more and more delegates and have an opportunity to have convention halls of the variety that we really deserve for the delegates who have come for this kind of an activity.
Sir, how good is the venue you have chosen, Hotel Ashok?
I must tell you that in the city of Delhi, one of the best facilities that the government of India has created is the Hotel Ashok. And it is situated at a very strategic place in the middle of Delhi, surrounded by beautiful ambience, and the kind of convention halls that this hotel has is amazing. And we are lucky that very recently they have changed some of their upholsteries, so our delegates will have a taste of the fresh upholsteries in the convention halls and in other halls that we have booked for this event. It has all kind of halls that we require, as big as to hold maybe 1,000 people, and then at the same time we can have different halls, whether it is for 2 hours or whether it's for 1 hour or even for half an hour, because those are the kind of deliberations that we are going to have. And similarly, there is a bulk of our students who have their posters for presentation and the faculty also, and it has the mechanisms in place to display their posters in the kind of ambience that we want. So it was really important to have a venue which is centrally located. And as we know that many people who come for the Congress do not come for only having the academic fees. They also want to enjoy the city that they have visited, and national capital of India. And it is always very interesting for people from other states to come and move around the various places in Delhi that they have heard of, and they find that they are very interesting, and there are a lot of write-ups that keep on coming in the various newspapers. So that's what is very important to see when we are talking of a venue.
Sir, and not to forget that it's very close to the tulip gardens also, and I hope they
Yes.
catch the tulips, the
Yes, by the
delegates.
time we are having the Congress, though this year the Congress dates have got preponed for by a month or so, and we are still expecting tulips to be around, and it is surrounded by the tulip gardens, and our delegates can have that feast.
So, what's your insight on the theme of Microcon 2025, which is clinical microbiology changing patient outcome?
You see, this has been very deliberately taken, and I must tell you that whenever we had congregations of our society or our speciality, I have always maintained that medical microbiology was never an antemortem science. It was never a non-clinical or paraclinical branch. It is a speciality that works in real time, and that is the way that it should be looked at. We are all working towards the outcome of the patients. Patient should go home treated. The beauty of this specialty and infectious diseases is that when you diagnose any patient with an infectious disease or having the diagnosis from the medical microbiologist regarding the disease of the patient, it gets cured. It's not a chronic illness more often than not. Most of the times, you diagnose a disease of infectious diseases, you treat it, and it is cured. It's not like hypertension or neurological illnesses where the hypertension medicines have to be taken for whole of your life. Parkinson's, you have to take the medicines for whole of your life. So there is no cure. We do not find any cure. But this specialty, it's an antemortem, real-time science, and should be looked at in that it should change outcomes by way of mortality as well as morbidity.
So, what's your priority contents for discussion?
We are acutely conscious as to who comes to our these congresses, and we do realize that we have all strata at various stages of their life who come to these congresses, and it's very popular destination for our postgraduates and PhDs, whether these are MDs or postgraduates who flock to these venues for getting some insight into the specialty that they are pursuing for the rest of their life. So we have kept for them precisely pre-conference workshops, and these workshops are hands-on workshops which they can experience with their own hands, and there are more than 15 to 20 workshops that are going to be floated, and I am sure that many of our postgraduates and junior faculty can find one or the another workshop of their interest. And once they have that kind of a workshop, they have hands-on on themselves with themselves, they will be able to learn. And it's well known, whatever you do with your own hands, you will be remembering it for rest of your life. Another area is when you need to listen to the authorities in our specialty by way of the knowledge, whatever recent knowledge has come up in by way of a continuous medical education. Those are the CMEs, and we have kept a pre-conference CMEs on the forenoon, and actually the whole day till 6 o'clock are three CMEs that we are going to have, on the inaugural day, that is 30th of October. And those are going to be very interesting. And the brochure will be released in a few days, giving the details of the CME. And one of the CMEs that will be conducted by CLSI, faculty will come from CLSI, and there will be local faculty also joining, and we will be having the kind of sessions that we require from CLSI and know from horses mouth. So this is one of the areas, and another part of it is that you have to have the agenda for the rest of the Congress, where we will have a plenary session addressing the theme of our Congress, and then have the symposiums for all 2.5 days, and we will have some industry sessions as well, and we will have also the debates that we all would like to have, where we find that there is a controversy in our specialties, or we need to discuss amongst our colleagues as to how the things should be. As so, we do usually keep those debates on the agenda. So that is the whole program that we are trying to talk about.
Are there any participation from the international faculty?
Yes, unless we have all-inclusive agenda by way of faculty as well. The congresses usually miss the global perspective. It was my attempt from day zero to try and involve the international faculty as well, along with our brilliant local or Indian faculty. So I'm very glad that we were able to take on board some of the very well acclaimed faculty across the world, like David Livermore, who will be with us, and many of you will be knowing him already or heard him. Patrice Nordman. Similarly, you will have heard him in admit sessions as well, and you must have heard Dilip Nathwani in our previous congresses that we did in Delhi, and that time he was at the helm of affairs of British Society of Antimicrobial Chemotherapy (BSAC), and we had sessions along with each other in Delhi. Similarly, we have Dr. Nancy Cardoni, who actually is a true hybrid. She did her MD microbiology from AIMS, then migrated to US and did her board certification in infectious diseases, and now has the art of blending both the specialties in a beautiful way, since she has the insight of both the specialties in particular, and she's currently in Virginia. We have Dr. Patricia Smith from Johns Hopkins, who will be joining us, and she is the director of the medical bacteriology and infectious diseases here in sequencing laboratory. We also have Dr. Madhukar Pai from Montreal, Canada, who is a authority in the field of mycobacterium tuberculosis and related diseases, and is very passionate about this science. And we will be actually joined by the galaxy of our star faculty from India, like Arnav Chakravarti, Balaji from CMC Bangalore, then V. Dr. Kamala Rodriguez, just to mention a few who are our star faculty to join the Congress.
So it's known that conferences help us network. What's being done in Microcon 2025 to facilitate the same?
Yes, that is one of the important functions of congresses, that you will have to allow the time and ambience for networking of all our colleagues, junior as well as senior. Most of the postgraduates or the PhDs can find a mentor for the rest of their career or at least for some part of their career, to further their specialty. And this is a very good opportunity to find a mentor when you are in a congress, and in a congress of this variety, where you have both national and international faculty of repute, and this is a godsend opportunity for them to have the kind of networking, and the various ambiances that we have chosen are the networking dinners at almost all the days that we have, and this will give them an opportunity to have this kind of networking.
So, what's there in the academic platter for students and for the faculty at various stages of the professional career?
You see, the younger faculty as well as the older faculty, I can say that maybe in the workshops they will find the kind of agenda that they are looking for, and they do not have the opportunity at the places that they have. Similarly, as I said, in the CMEs, they will find some of the very important contents being discussed, as I told you about the CMSI guidelines that we keep on discussing every year when the new guidelines come. And if you hear from the horse's mouth and address the controversies and the confusions that we keep on discussing every day in our own departments around the year, so it will be very interesting to listen to them directly, and you can ask your own questions to them to have some kind of clarity. And then again, as I told you, the microbiology area where we are talking about non-tuberculous bacteria is also another heading that we are put as a CME, which is going to be very interesting for actually across the board for all medical microbiologists.
So, is there any incentives for the early bird registrations?
Yes, it is done every year, and we have kept till 31st March early bird registrations. The incentive for that is also the first 50 on first come first served basis. They can register for free for any of the 3 CMEs that we are going to float. So that is an incentive for them to have to get registered as quickly as possible. And the last date, as I said, is 31st of March 2025.
So, what excites you most about the upcoming event and your message to the delegates?
The most exciting part of this is that it was my cherished dream to hold this kind of a congress with this kind of a theme. Because not always I was having the consensus whenever a conference was being or a congress of our society was being held. But everybody was acutely conscious of this fact that we need to take it up as a bigger platform where most of us are there, and try and make it clear as to what is our goal for the specialty. As medicos, we all need to have the same goal, that's the well-being of the patient. We all know that mortality and morbidity can be changed if there is no infectious disease diagnosis. And if it is there, you can decrease it by 40 to 50%. So that is one of the incentives that I had, and that's why I was very excited when this finally got formalized, and we were given to organize this kind of congress. So that's what excites me the most. And my message to all my comrades, junior as well as the seniors, would be: come on and join the congress, make it a big success. Let us learn from each other and try and get the best possible from this congress in every aspect, not only the academic. Come and see the national capital of India for yourself, and the known corners, they are very popular, whether it is in the Chandni Chowk or in the south ends of the city. Thank you very much.
Thank you, sir, for sharing your views. And we all look forward to meeting you all at Microcon 2025 in Delhi. Thank you.